My name is Linda Jackson. I'm a DMP student at Brahman University. My presentation is on health belief model. Health belief model suggests that a person's belief in a personal threat of an illness together with the belief in the effectiveness of the recommended health behavior or action will predict the likelihood that the person will adopt positive health behavior. My clinical scholarly project, CSP, states that young adult obesity is a threat to health and life. Therefore, the introduction of motivational intervention will bring change in behavior to engage the obese into physical activities and healthy nutrition. Two components of health belief models are: 1. The desire to avoid illness or get well if already sick. 2. Belief that specific action will prevent or cure illness. 6 constructs of health belief model. 1. Perceived susceptibility. A person's feelings of personal vulnerability to an illness or disease. My CSP. The obese young adults with body mass index greater than 30% are aware of possible future health problems that need intervention. 2. Perceived severity. A person's feelings on the seriousness of contracting disease or leaving the disease untreated, and often a person considers the medical consequences, example, death and disability, and social consequences. My CSP. Obese young participants are tensed that the obesity may jeopardize their health and cause more illnesses like heart disease, cancer, high cholesterol as they grow into adulthood. 3. Perceived health benefits. A person's perception of the effectiveness of various actions available to cure illness. The action a person takes in preventing the illness relies on the evaluation of perceived benefit, such as that the person will accept the recommended health action. My CSP. The available option to assist young obese participants is offering motivational intervention treatment plan that will motivate and elucidate the benefit of losing weight. 4. Perceived barriers. A person's feelings on the obstacles to performing a recommended health action. A person's feelings of barriers will lead to a cost and benefit analysis with the perception that it may be expensive, dangerous, unpleasant, time-consuming, and inconvenient. My CSP. The project participants will be communicated to that the implementation of MI has no financial cost attached. 5. Cue to action. A stimulus needed to trigger the decision-making process to accept a recommended health action. These cues can be internal, example, chest pain, or external, example, advice or handout. My CSP. Conducting the project by giving out educational handouts on physical activities and good nutrition will be a motivational tool to spur participants into action. 6. Self-efficacy. A person's confidence in his or her ability to successfully perform a behavior. My CSP. The ability of the participant to sustain the weight loss during the 8 weeks of project implementation will help in sustaining the behavior changes of engaging in physical activities and having good nutrition. Health belief model thrives in communication. Communication in healthcare is a problem as well as a solution between providers and patients in administering treatment. The intensity effort to listen to and better understand the need of the patient has always been a challenge with communication and feedback. Importance of healthcare communication. It improves accurate patient reporting and disclosure, reduce uncertainty, engagement in decision making, increase social support, effective utilization of health care options and facilities, better adherence to treatment regimen, improved clinical outcomes, and enhance prevention and wellness. Thank you for listening to my presentation. Goodbye.